Now, one of the questions that is always asked is, what's the evidence for integrated care? What's the evidence for acute demand management? What's the evidence that these things make any difference to anything? Research and evaluations at a very early stage in this space. Some elements of integrated care are of proven value, and I'll talk some more about those in a moment. It's actually a really complicated thing to evaluate integrated care because how do you define and monitor KPIs? How do you define and isolate individual initiatives within a multifaceted program? How do you wait for long-term impacts? You know, you might be waiting 5 to 10 years to see whether what you're working on actually is going to have a population health impact. And if you're interested in doing randomised controlled trials in this space, then how do you identify the control groups and keep them in a control space for that sort of period? So it's very tricky stuff. Another reason it's really tricky is because it's very difficult to realise real money out of hospital avoidance programs, as I'm sure many of you have experienced. And that's really for two reasons. One is elegantly named demand elasticity. So there's always another patient to fill the bed unless you close it, and that's not a bad idea. And always, because of incentives, there's compensating practitioner and hospital behaviour. In other words, more demand is always found, and doctors, being very clever people, compensate for when they feel threatened. Hospitals, being very clever and self-adjusting organisations, always compensate for loss of business. So it's a very dynamic environment. Despite all of that, policy expectations are really high, and as I said, most developed countries' health systems are going down this track. For those of you who want to read something about this, there is a very interesting review article by Dr. John of Ritveit, the Scandinavian with the unpronounceable name, who's a very big man in health economics circles, the Health Foundation 2011. From his review, he says, yes, it does work in preventing hospital admissions, identifying patients most at risk and doing the right thing for them, counteracting the increasing fragmentation of subspecialty services, and most importantly, the people who benefit most are those with the greatest needs. In other words, the people who historically have missed out and become overrepresented in health inequalities.